Good morning. I live in Boston, which many of you know is a major academic hub, and healthcare is no different. You basically can't spit without hitting a doctor in Boston. But even so, there are people who live in Boston who cannot get the medical care they need. Who are they? Why is this? Well, it's not for lack of specialists and doctors. I just told you we have plenty of them. And it's not because these folks lack health insurance, because actually everybody in Massachusetts nowadays has health insurance. The people I'm speaking about are older patients living in nursing homes with dementia. Now, some of you may know someone with dementia who's a little bit more forgetful, maybe not quite as sharp as they once were, but these are not the people I'm talking about. I'm talking about people with a more advanced state of dementia. People who often cannot walk, cannot feed themselves, cannot bathe, cannot use the bathroom alone. People who require such intensive, around-the-clock care that their families can no longer safely manage them at home, and so they're put in a nursing home. Now, nursing homes have doctors and nurses, but the doctors who work in nursing homes are general providers. They're not specialists. They certainly do their very best, these doctors and nurses in nursing homes, every single day, trying to take care of these folks with dementia who are generally very complicated medically. They're older with multiple medical problems. But the specialists work down the road in their office, clinic, medical center. And if you're a nursing home doctor who wants to send one of your patients to see a specialist, perhaps a neurologist, you'd have to put this person in an ambulance or a chair car and send them down the road to see the neurologist. You'd probably have to send them alone because most nursing homes lack extra staff to send someone with the patient to accompany this person. So you have this confused older adult, perhaps easily agitated, going down the road in an ambulance alone to see a specialist. And when the specialist has questions about why they're there or what's going on, that individual is unlikely to be able to answer any of those questions. It would be so much better if perhaps the frontline providers, the nurse, the doctor at the nursing home, even the nurse's aide, could talk to the specialist. And not just one specialist, because people with dementia living in nursing homes are complicated. And they often require multiple specialists to get the type of help and care they need. I want to stop a moment and reiterate a very important point. In Boston, we are fortunate enough to have more doctors and specialists than perhaps anywhere in this country, even in big cities. And yet there are people who cannot get the care they need. We are failing to meet the needs of this population. But the good news is, we at Beth Israel Deaconess in Boston have figured out a way around this using ECHO. We're fortunate enough to be supported by a private family foundation. We have a group of ECHO specialists, a neurologist, a geriatrician, a geriatric psychiatrist, a social worker who specializes in behavior plans for nursing home patients, come together to support the frontline providers, the nurses, the doctors, the nurses' aides, even the families of patients living with dementia in nursing homes throughout Massachusetts and Maine. We're able to come together, work together, and create care plans for this complicated population. And we learn from each other every day. I'd like to share with you a story of a case we all learned from. One of our nursing home partners presented a case of a woman who had lived at their facility for a few months. They thought was a little paranoid. She was telling people that someone was going to take her to Texas, which in Massachusetts is a liberal state. You can see why that might be considered a paranoid thought. She also was noticed to be easily agitated during group activities. more so than they thought she should. And they wondered if she needed a medicine to stop her paranoid thoughts and calm her down. And they probably would have sent her down the road to see a psychiatrist if they didn't have ECHO. But they presented her case to our ECHO team. Our entire team, our neurologist, our psychiatrist, our geriatrician, our social worker, listened to her doctor, her nurse. We talked to her nurse's aide, the woman who spent hours every day with this individual. We heard about her medical history, her medications, but the important social factors that were at play, strategies they'd tried that they thought were not successful or partially successful. We talked about her case for over half an hour. And it was the neurologist who figured out what was going on. You see, this lady'd had a stroke some time before. Everyone knew that. But what had not been appreciated was that this woman's stroke had left her with a condition called left-sided neglect. Now, not all strokes cause neglect, but hers did. And what that meant was she really couldn't properly perceive what was happening when things happened on the left-hand side of her body. She might hear things but not understand what they meant. She might not really be able to see things correctly. And so our team worked with the ECHO team, or with the nursing home docs, the nurses, the staff there, to come up with some strategies for her. They rearranged the furniture in her room so that her bed was better positioned, so that her bad side did not face the action. Because in retrospect, when we were thinking about this with her primary team, they realized that the hallway was on her bad side when she laid in bed. And they suspect she overheard some nurses or staff talking about going on a trip to Texas, which she later recounted to her team as someone's taking me to Texas. And that, out of context, could seem like a paranoid thought. They also, in the activity room, positioned her wheelchair so that her bad side faced the wall and her good side faced the action. And she did a lot better. And she was not put on a medicine that she did not need, a medicine that very well may have decreased her quality of life, and most certainly would not have addressed the root cause of her problem. So, if ECHO works so well for nursing home patients with dementia, why don't we all do it? Unfortunately, this type of video consultation is not paid for by insurance or others. We're fortunate to have a private family foundation supporting our work right now, and they have been for the past couple of years. But we, in this room, need to figure out a way for this type of care to be available for all those who need it. Because we know that if in Boston, where there are so many doctors and specialists, and yet there are people who can't get the care they need, there are people everywhere who would benefit from ECHO, and without it, will suffer needlessly. Thank you.